What if I told you that ABA was first tested on animals such as dogs? It's a crazy concept to wrap your mind around, but it's true. ABA was discovered by two psychologists named Ivor Lovaas and Robert Kogel. They published their research on the principles of behaviorism and tested it on patients who have autism in 1950 to about 1960. Their theory is based on understanding why the client is behaving how they are and trying to intervene and help that behavior and replace it with a better one, essentially. So, before jumping in to my main points, it might be essential to explain what ABA is. So, ABA is an acronym which means Applied Behavioral Analysis. Essentially, that means that you take a behavior, for instance, you can say aggression, and you analyze it, why it happens, taking data, making small goals, trying to lessen the behavior. You take all of that data and then you try and to apply it. So this essentially means that you are trying to move the client into doing more positive forms, so no aggression, and basically using a replacement behavior. This is done by using positive reinforcement. So it can be as easy as giving a client a toy that they love, or say they prefer food. A lot of kids prefer food. I know I did. So you can give them like a lollipop if they have like less aggressions, or like if they did something and the behavior was extinct. So jumping in, there's a lot of things that ABA can help. One of them is called adaptive behavior. So essentially, by applying ABA for adaptive behavior, it can improve on socialization skills with relationships with peers, family, romantic relationships, etc. It can also give the client a basis of what communication should be like, and as well as allowing them to grasp the concept of how to vocalize their wants and their needs in a correct and positive way without exhibiting maladaptive behaviors, which essentially that means such as hitting, biting, screaming, scratching, spitting. The list can go on and on. Okay. So along with adaptive though, we also see that ABA can help with behavioral. So like I said previously, with behavioral, it can help with correcting bad behaviors and replacing them with acceptable communication, such as a kid wants something and they're hitting someone for it. And they have to be made aware that's not okay and that's not the correct way to ask. So they are given a correct way and modeled way to ask for it. It also instills better functional communication. So instead of lashing out, like I said, they don't participate in extinction behaviors, which extinction basically means that they are climbing up a ladder per se. And the behaviors that they are climbing up they're getting worse and worse and worse, and they're just trying to see how far they can push you. As soon as they get to the top of the ladder, they realize they can't do it. They're not getting what they want. So they start to fall, and they go all the way down and crash all the way down and stop doing those behaviors and do the behaviors that get them what they want, which is the positive ones, because they are reinforced. So the third one, lastly, ABA can help with educational and academic skills as well. There's a vast amount of ways that it can help it, but some of the major ones that we look at are it can help with educational and intelligence setbacks. So we do schoolwork. If a client is struggling with not having a one-on-one rather than being a one of 26 in the classroom, it makes it really hard when they don't have the one-on-one support that they need, because they might need a lot of prompting to do the task that they are asked to do. And then another one is we do this by running things that are called DTT trials. So it's discrete training trials. And essentially what that means is we are trying to instill specific skills that they should be doing, and it needs to correspond and go into the real world, which are NET trials. So it's natural environment training. So really switching those skills that they learn and switching them and transferring them into the real world so they can use them, and it's not just they're learning it and they're only doing it when they're with the technician. So in conclusion, to reiterate what we have learned in my presentation, ABA therapy can be a great way to benefit adolescents in adaptive, behavioral, and educational difficulties. It can improve vocal and adaptive skills. It can help with behavioral correction skills, and it can help with educational and intelligence setbacks. While everyone is different, I think that there is a lot of number of adolescents who can benefit from ABA therapy. And if you're interested, I would look into it, and I do this as my job and I love it. Thank you.